And you are live.
This is the Committee of Conference on the FY 2023 budget, and we're continuing our work. Obviously, a floor time has kind of had an impact on our scheduling. So, gotta push the got it button. So what we have outlined, we'd like to see if we could take care of today. We postponed it yesterday, and that is the proposal that Representative Fagan and Senator Westman have been working on relative to prevention and substance use disorder funding. And are you ready to present your package now?
We are ready.
Okay. Copy of it. Okay. There's a couple copies there.
Is that document coming, or where is that document?
I'm sending it right now.
Okay, great.
Well, Senator Burrs, if you were here, I'd give it to you.
I'm missing sliding pieces of paper across the table.
Extra copies. Thank you. Okay. So everyone have a copy now? We're still waiting to get it.
I think Senator Baruth is still looking for it.
I
Looks
am.
like it's in a search.
Yes, kind of watching his eyes.
There we go.
Okay, good. So
why don't we proceed then if everyone's got the copy of the document?
So thank you. Overarching concept here is to better coordinate our substance use disorder and prevention efforts statewide. We have a new chief prevention officer in Monica Hutt. She's a real leader. And personally, I love to employ real leaders. And so you're going to see a lot in here that narrows what we might have done in the past and moves it into the Department of Health so that she can work the issues and make sure that we compound our effect by building on efforts that are occurring here or have occurred in the past and certainly will occur in the future. So that's kind of the basis for what Senator Westman and I talked about and kind of what you're going to see here. So the first thing is, and this is one-time general fund, $3,640,000 to the Department of Health ADAP, $3 million and a grant for the Substance Misuse Prevention Coalitions, and then
wait a minute. Okay, so we have both here new and ongoing initiatives. So are you talking about, are we getting base funding and one-time funding combined here?
So you're going to find base funding in this document in some places, and in other places one time. This is a one-time document, and then if you look under sub 1, it's going to speak to being funded with the cannabis excise tax once that comes fully online. So it's one time until it becomes fundable with base excise tax.
But not this year.
But not this year. This year it's one-time general fund.
All right, okay. I was just looking at saying from the general fund for new and ongoing initiatives. That's what I was trying to clarify.
Gotcha. Okay. So $3 million, as I said, to the coalitions, and then ADAP. There's RBA language in here that ADAP will request a report that speaks to what activities have been done, the number of people served, and information on the outcomes. That report will come to the appropriate committees in January of 23. And then under sub 1, it is intent language that future funding for the coalitions, we're going to fund with one-time general funds until funds from the excise tax revenues become available. So that's the first thing.
I think Peter, you ought to mention the tobacco money at the bottom because they go together.
Okay. So
I want to get back to, we have, oftentimes our reports are all inputs and very little on outputs. So you have information on the outcomes by this, and so have those outcomes been defined?
we have not defined the outcomes here. This is the extent of the language that we have proposed.
Representative Fagan,
Yes.
can I just ask on the excise tax, am I right that this is money that is already in statute that's going to be flowing to substance misuse prevention? We're not contemplating a new outlay of those monies that haven't yet been determined?
I'm going to ask Senator Westman to answer that one. He's far
I
more
think the
versed.
answer is that this will be a bridge until those excise revenues materialize.
That's exactly right. And there was some issue that we talked with Monica about that they weren't sure there was going to be enough at that. So as when you get the whole proposal, you will see that. But the prevention money is, we're putting a stake in the ground. This is the first place that the cannabis money and the share that we were that we've envisioned going to that would go to prevention first.
Oh, okay, I just want to be clear before we move too far. There is money that's already in statute for, and this is the sales tax, I believe, for after-school programs.
That's right, because it's the sales tax and it goes into the ed fund. And
Right,
that's the after school. The excise tax would fall to the general fund.
Well,
And that's where we have that construct, but the statute says 30% would go to prevention.
And the
Right.
reference here
So this is-
the 30% piece.
so this, I'm assuming this is part of the 30% that
Yep.
has already been deeded. We're not
Yes.
deeding additional money.
Yeah,
Yeah.
I think the 32 VSA 7909 is the 30% dedication section of
Right.
statute.
Okay,
And
so that's fine.
And that's
Yeah.
why number one is so important when it says it is the intent that they be funded with one time until funds from the cannabis excise tax revenues become available. So that's what is the bridge function here.
Right, and my only reason for bringing that up is that there's obviously still a looming question about what will happen with the other excise tax funds. I put in a proposal this session, as did a number of other people, and clearly we, as a body, we've deferred that. But I don't want to make any piecemeal decisions on that remaining 70% if possible.
No, this does not. The only question that I have, and that is the extent to which we're preempting how, we're saying 3 million will go to the coalitions until the excise revenues come forward. In any way, are we obligating that those 30% dollars are committed in the long term to the coalitions?
You're not actually obligating it, but you are sort of prioritizing in this intent language.
Well, that's my point,
Yeah.
yeah. So I just want to make sure that, and how much are we spending for coalitions now?
They have 5 coalitions up and running, and I believe it's under $1 million. I cannot remember the exact number. But there are 5 coalitions in different parts of the state. And the Monica is working to stand up the rest of the coalitions. There used to be coalitions once upon a time. Funding stopped, and they want to get them restarted, and they want to coordinate their work, and hence this appropriation.
Okay, well, all right, we'll keep going. I think longer term, there'll be more discussion when we actually know what that money looks like, but let's keep going. So we have.
So at Senator Westman's suggestion, I'm going to go to the tobacco fund, section B 1101 fiscal year 23 one-time tobacco fund appropriation. And the reason why I want to do that, and a good idea, is because we again speak to the prevention coalition here. So FY23, we're appropriating the additional funds that we received from the tobacco fund. Remember, it was about $1.7 million of additional funding that we were not anticipating. It's going to Department of Health, ADAP, and $1 million for substance use disorder and tobacco prevention and cessation activities. Substance misuse coalitions and tobacco cessation programs that target youth vaping may apply for these funding. The commissioner shall determine levels of award for award applicants, and then sub I, speaks to, again, a report back. It's the RBA.
Well,
And what
the
we
report
heard,
back is only as good as the data being reported back. Okay, go ahead.
and what we heard from the health department and what we heard from the players in this field is that a lot of the people that are in prevention have been working in silos, and the attempt here is to get the tobacco people and all of the prevention groups working with the money coming through the health department, so it's a coordinated effort.
Well, that's a laudable goal. So let me ask then, the Department of Health, okay. So the $1 million in B1101, the one-time tobacco funds. That $1 million goes to the coalitions as well.
It all, in my mind, I see it as a package of 4 million with the tobacco groups that are
Yeah, thank you. I just wanted, so it's the 3 and the 1 for a total of 4. That's why I just wanted confirmation that
That's correct.
that
This-
we had to draft it this way because it's 2 separate sources of money.
Okay, all right, thank you.
And we're putting more emphasis on Monica Hutt's work here by doing it this way as well.
Well, we certainly feel that that is important, and that's why we created the position.
Yep.
So you want to go back and?
Yes, I want to go back to the front page again and go to sub 13B that has been crossed out. We're going to delete the mobile medication assisted treatment of $100,000. Right now, UVM is fully funded with federal funds, and they are doing a pilot. At the end of that pilot, we anticipate that they will come forward and say, this is what we've learned, this is what we would like to do, this is what it will cost. So this is the funding request, but they're not prepared to do that at this point in time. So right now, we would recommend that we strike the $100,000 for the mobile mat.
And did we both have that in our bills?
You had it in your bill, we did not have it in ours.
Yeah, it's hard to remember. All right, and then in B, you're agreeing to do the full 500,000 that was requested. So
That's correct. So it's a full 500, 400 in base and B 313 and the 100,000 here in one time. I'm just not convinced we've got the base available to get all the way there with base.
Okay, so we had 500 in base.
Yes, it's the same net total for FY '23.
I understand that, but that frees up 100,000 in base.
Yep.
Yes.
Okay, all right. Recovery centers, that's.
Same dollar amount, just it's back in one time in lieu of base.
it's
Same
what-
concern, not sure that we have base.
I thought we did.
Well,
We're still working the number, and certainly the recovery centers, they could certainly use the money, and we continue to respond to their needs and their great work with one-time funding.
Well, let me see what we have for money because, obviously what we have within our revenue box to build the budget will determine what we have for base funding.
Yep.
And I would, before we make a decision to move to one time, if we can accommodate it, I think considering Senator Westman, how long since they've had an increase?
5 years, and
Oh.
I would say that I would much rather have this in base if we can accommodate it.
Okay, and I think maybe the House would agree, assuming that we've got the base capacity, recognizing this is ongoing part of the treatment and recovery system. So,
Let's see where we are, and then we can make the decision.
yeah, all right.
So the next item I'm going to ask Senator Westman to cover, because what this comes out of the $100,000 that you inserted for the UVM Comprehensive Care Clinic that was found in section B as in Bravo 312.
Yeah, and what we were asked about from University Health was to fund. They go out and they draw blood from AIDS patients,
Right.
and $50,000 they were short in that area. We put the 50,000 in base because that's the long-term ongoing piece. The other 50, which is the 50 that you see here, they said because of COVID, they've seen an increase in a number of patients that need mental health treatment and
1,200,000.
and so and they already have a halftime position there. The thinking is
So we had 100,000 all in base, and what you've done here is
move 50 to one time.
move 50, so 50 still stays in base and 50 is one time.
Yep.
All right.
Yep.
Now we're down to XX.
Okay, so this is the part that you were referring to earlier, Senator, when you said there's duplicative pieces, and the duplicative pieces in Senate Bill 11, which you heard this morning, and that's 1,290,000, I believe. So recommendation here is that those funds not be employed in S211. I've already talked to the individuals who will probably be conferees for that, and told them that we do not that at this time doesn't need to be used for this effort because we have it in the budget here. And so I'm about to explain this budget. So it's 345,250 to Dale, and we're going to set up two pilots. One is a 2.5 FTE pilot, employment assistance at recovery centers. And this recovery center will be the one in Burlington. And then you can read what each of the FTEs are, what each of those 2.5 FTEs do. And then the second one is a 1 FTE pilot at one of the other recovery centers somewhere around the state for $75,000. The intent here is to help people that are really trying to make something better of their lives, to help them find work and make it just a little bit easier on them so that they can move forward with their lives. And so that's what this does. It's a 2-year pilot, although this funding is only for 1 year, but this is a 2-year pilot. And then on or before 2024, Voc Rehab is going to report back to the appropriate committees, and you can see the what we're asking for: educational attainment, achievement of program recipients, the acquisition credential of value, number of placements, job retention rates.
The proposal that was included in S11, did they include the funding for both years of the pilot, both 1 and 2?
It did not. That was a 1-year funding amount for 15 FTEs, I believe, at every, and at least 1 FTE at every recovery center as a pilot.
Okay.
This is a pilot. That is not a pilot.
All right, so you're going to go to your conferees and suggest that they defer, remove that, and go with the budget version.
I already have, and they have concurred. I've talked to the committee of jurisdiction, and they have concurred.
Well, but on the Senate side, I just referenced the fact that there was funding probably in this package, so they'll have to concur. That's the only point. So your folks have agreed to this. I'm just saying, the Senate conferees haven't seen this and haven't agreed to anything at this point.
Right.
Okay. Well, we've already done 1101.
Yes.
And probably should get down to number 2, which is around the syringe or needle exchange, because that was, we had it bundled, and then we heard from providers that they really wanted to have the allocations made very specific. And I see that's back to where we are.
Yes, except that there's been a change. Senator Westman felt strongly that he wanted to increase the amount for the AIDS service organizations referenced, and I don't have it on here, so I'm going to speak to it, that we're in section E is an Echo 313, I believe. It's the Ryan White language. And
Yeah.
it's been $150,000 for the 10 years that I've had this budget for syringe exchange programs around the state. We're going to bump that base to $300,000. And then in addition to that, you have this 350 one time going to the AIDS service organizations, 150 granted to those service organizations for syringe exchange, 200 to the Howard Center's Safe Recovery Program. As you know, they have over 5,000 members from every county in the state of Vermont, and Safe Recovery provides low barrier access to bupe treatment in addition to naloxone and trainings on overdose prevention.
So this is, this language still, from my point of view, doesn't reflect the 300 there's 150 that's been in base for years.
Yes.
And the attempt is to add 150 to that. Oh, well.
And we did.
Add 150 to that. So this does do that.
Yes.
What I would say to you is that both the health department, Monica, all the players that were involved said that this is the pieces, and there were so many out there for syringes, that we're talking when there has been 150,000 in base, and you're going to add on top of that 560,000. They are adamant that the money should be going to prevention and not for syringe exchange. They can see some increase in that area, but the push from them was to make sure as much of this could go into prevention as we could put.
Well, I'm having a hard time following that because you are increasing the base. Now, the, for syringe program, so the note says 150 in the base and 312.
Yep.
For
And
total
then, and then,
300.
right. And then the 200 to the Howard Center.
Yes.
That's where the 350 comes up with.
All right,
So
So the 350 is tobacco money, and the 150 that they're adding in 312 is general fund base money.
Yeah.
That second bullet under 312.
so you're increasing on an ongoing basis the money going out to the AIDS service agencies from 150 to 300?
correct.
That's where the conflict comes. I would have done that with one-time money.
Did we get a request? Or is that?
We-
Yes.
Department?
Yes.
We've had numerous requests.
Yes.
We've had numerous requests for syringe money, and all of this is related to syringe money. My push in this has been to make sure that the money went with the 150 that has been in the base for years, and it all go through the health
150
department.
is for more than needle exchange though.
And so this proposal does an additional 150 in the base, not one time, but in the base, going to the health department into that appropriation.
And that's where I disagree. I wouldn't do it in base. I would do that in one time, the 150.
All right, but the Ryan White is more comprehensive services than just needle exchange.
Yep.
Yep.
So what you're proposing here, although you're kind of the dissenting voice, but you agreed to it in the end, I guess, is to increase the Ryan White money with additional general
With
fund.
an additional 150.
All right, for a total of 3.
Yep.
Okay.
Except that what we're looking for is an addition to the base here, so that it carries forward into future years without us having to then bargain it. And there's been a lot of requests that we had from people on the public hearings, and the committee of jurisdiction took a lot of testimony in this regard. So the request to bump it up was something that they had wanted to do all along. And the 150 here in the base pays homage to all of those efforts and requests.
Yes, and that was completely opposed to what the health department wanted.
And let me ask, in the House passed budget, did you increase the Ryan White money by the 150?
They did 360.
You did 360?
We did 560.
Okay.
We did 560 overall in the House passed budget. And at the time, because there was, we really didn't have the ongoing funds, I convinced the committee that to do it in one-time funding overall. And that's what we had in the House passed budget was 560.
You did 560, you did 360 for the organizations. You did 200 for Howard.
That's
and
correct.
Money is here. The Howard money at 200 was the number one request of your House Human Services Committee. And so that money's there. So the difference is really the 150 versus the 360. And the 360, I will tell you that all of the players that are in,
Thank you. Okay, all right. Well, shall we go on then? I think I've got it.
Sure.
And can I
Yep.
ask, I'm trying to follow you. I began with the assumption that this was an amendment coming from Representative Fagan and Senator Westman, and that there was agreement. But it's sounding more and more like there's an ongoing disagreement. I'm not.
the disagreement between us is it wasn't clear to me in this. I thought this was one-time money in this.
I see.
Let us describe this as the House's offer.
Yeah.
You all, the Senate should consider it and we can take it from there.
Thank you.
Got
Just to clarify in.
I think what we agree upon is all of the numbers and amounts. The question is whether it's base or whether it's one time is still, there's some issue. But I think we agree upon all the pieces.
Well, the dollars that are in here right now would total $500,000, 150 of general fund ongoing base and 350 of one-time tobacco money. So that's the dollars that are in this offer.
Okay, all right. Well, we'll keep going.
Okay. So
This
the
is
next is
part of the
the,
exchange. We haven't agreed to anything, Senator,
Right.
getting the run through
Got it.
time. And I think some of this is going to be contingent on, obviously, what we have for base money and how we want to allocate that.
Yep.
313,
okay, so 312, we already went over 313. Just to reiterate, we're funding Jenna's House 400 general fund in the base and 100 one time. And so that's where this is. So that's the 500,000. And then the other thing is we'll accept the 200,000 for residential beds, sobering beds, and recovery house. And there was a minor change on the language for E313 report that added an analysis of financial models, which is fine.
we put that in.
200,000 or 2 million, Peter?
I'm sorry. It's 2 million.
Yeah, 2 million. And it was,
I'm sorry, I said 200,000.
all right. And then, well, here's the financial model down in 313, and that's what's referenced in the asterisk.
Yes,
So, the language here in 313 in the yellow, report public inebriate and sober bed programming. The only thing that got changed there is the report shall include an analysis of financial models.
correct.
Could you explain what you mean by financial models?
I'm gonna ask Senator Westman.
There was a request from the mental health agencies, and actually Julie Tessler sent something, and they're worried about the overall. Most of these inebriate beds are the organizations are losing money, so they're very concerned about the money in this area. And this was an attempt to, at least when we got the report back, that there would be a piece of it that would look at the fact that they're losing money on these beds now.
I wouldn't know that from I don't know how, financial model is so vague to me.
This was very much the very last minute at trying to add something.
Yeah, would it be better to say the report on the financial sustainability of the
That would be perfect.
programs?
I would think so. I mean, it seems like that's what we're really talking about is the fiscal, financial, yeah.
Sustainability of the programs.
And then the other thing that's not on here, and I've asked Sarah to go through it, is we have the rate increase for the residential treatment facilities and the proposal to add preferred providers to it as well. We had $880,000 in base GF in the budget, and that would have equated to, I think, 25% rate increase on just the residential side. So the recommendation is going to be an 8% across the board, but I'll let her go through it, please, because she's got the numbers.
Yeah, if we want to move to an 8% increase for all of the preferred providers, it will, because we'll be able to leverage Medicaid global commitment dollars, we can, using $550,000 of general fund, we'll be able to leverage and in total, $1,249,000 of global commitment funds to be able to provide that 8% increase to the preferred providers. It's a little bit nuanced because if you recall in the budget adjustment, using the HCBS enhanced FMAP opportunity, part of the plan that AHS submitted to CMS is giving a 3% increase to the preferred providers. So to get to the actual 8%, it's a 5% that we're needing to fund, and that's what we can do with $550,000 of general fund.
All right, so, but we knew that would free up some general fund, and that helps us deal with some of the other areas of base that we haven't, that we need to cover, hopefully. Okay.
So that's it for this presentation.
Right.
So just to sum up, it sounds like what's open mostly is the 540 recovery centers in the base or the one time, and then this question about the syringe base or one time, is that?
That's yep. And it's all the question of whether it's base or one time.
Well, I would put the Jenna's house in there too.
Okay.
Because we had them in base, and depending on how our base works out with what we have in our revenue box, then we may have some ability to, I'm not sure all of them, or some of them we can prioritize when we get to it, but that's, those seem to be the two.
It doesn't sound like there's a difference on the number.
No, it's not the numbers, it's just
It's
one.
where, which column they want in.
Yep.
And so I'm not going to argue with that. We need to see what we have in terms of one time and base. I would note that our Human Services Committee had some reservations about this funding for this particular provider. But we went ahead and funded it at the 400 level. And anyway, I just felt that I needed to note that there were reservations on our side about funding that. I'm not arguing with the proposal here, and just again acknowledging that we need to sort what do we have in one time versus base, and then we can drop numbers in.
Sure, that's fine.
Okay, and then I think we all, Rep. Fagan has another piece of language that he's ready
Yes.
to offer.
This is C107, and it's 107.1, 107.2. It's reversion, it's two pieces of language. One,
Print that out and send it to senators.
We're gonna send it, don't worry, don't
Thank you.
react, it's on its way.
And which one is it? The nurse
I'll,
one?
I'll CC you, Chrissy.
Never comfortable to have to ask for handouts.
You got it, okay, you're ready to go? Here. And as soon as Senators Bruce and Western have it.
Teresa, I now just watch my junk mail and it comes right in.
Is that a comment about
So
us?
funny.
No, all of Teresa's communications to me go to junk mail for some reason.
Did she just send something?
So
I
this,
haven't
I
seen
just
it
sent
yet.
it. It should be there.
Thank you.
Not before, but it's the right way to do it.
all right, so Stephanie tells me that we've seen this, we do remember the discussion around the forgivable loan, and so this is a rewrite of that, this isn't the reversion of the.
No, it's C107.2 is the other. So C101, C107 and C107.1 together would do the nurse.
We get rid of the scholarship and replace it with
Yeah.
a loan, a forgivable loan.
Anything
program.
that's left over in the nurse program on July 1st would transfer over to the forgivable loan program for the nurses. We have to repeal what we did in the budget adjustment because we carry forward global commitment, which we don't normally have a carry forward for. And we would do the general fund pieces into the loan program and still be able to match it up as it fits in the global commitment, as it's allowed in global commitment.
Okay.
So it's the intent of what was presented last week by Representative Fagan. It's just technically how you would do it, you have to do it in the C section in this year. And then the conversation, the new item on here is what's in.
Well, let's
C1.
close out C107.1, which I think we had some discussion about, and this now makes it clear that, we know that we had some discussion around scholarships versus forgivable loans, but we understand that rather than the clawback and the administrative complexity of the scholarships, that the forgivable loan is administratively simpler. So I'm prepared to move and close this language out if you want to give me your thumbs up. Freeze. Okay.
Since I'm offering it, yes, but thank you, Stephanie, for explaining it because it's highly technical.
All right. Now we'll just see 107.2.
So basically what's going on here is that we have the primary care physician scholarship. It allots up to 10 scholarships for individuals at the UVM Lerner School of Medicine. If you, right now, the tuition is in the 40s, $40,000 a year. So there's over $1 million of global commitment that goes into that and annually. So we're building up a reserve in essence that we don't need unless you create more individuals that could receive that scholarship, which we're not recommending here. It could be recommended going forward, but that's not the intent of here today. Today, we're just talking about reverting the funds that have not been used, will not be used, and then freeing up the general fund for use elsewhere.
So we would revert the 267.
Yep,
And the 438.
correct.
Those are the unused.
I know what they
And
are.
if you remember, the first year that Act 155 went out, was signed into law, and Act 55 started, there was a problem. And what ultimately occurred when we came back into session that following January is that no money had been dispersed yet. AHEC was being asked to do something that they normally wouldn't do. So we asked VSAC if they could partner with AHEC, and the two organizations have done a great job in standing up a memorandum of understanding, working together and getting these funds out to individuals that have agreed to perform primary care duties here in the state of Vermont when they're through their physician training. So that's worked very well, but it kind of put us, we were 1 year behind. And so funds were not used. And then again, because there's $1 million here of GC, and right now the most that you would use would be the high 400s, maybe 500,000. Let's make it easy math. So we're building up a pot of global commitment that we're not going to use. So we need to do something with that, and hence the reversion.
Well, but you're not reverting it for a specific purpose.
You are correct.
And so one of the questions that I want to throw out is with all the shortages, and we hear it all the time in the medical arena.
Yep.
Whether we're talking about physician assistants or advanced practice nurses or, whatever, should we not revert the money, keep it still within this box of healthcare workforce and at least on a one-time make this money available for an expanded group of eligibles?
We're talking, yes, but I think that's a policy question that needs to be explored next year by the policy committees to determine where best to allocate those funds. Right now, for
But if you
FY,
convert them, they're gone.
they're gone.
So
But in
you don't
FY
have that-
22, FY 23, there will be $1,236,770 in global commitment funds to go to this scholarship. It will use, if it's at $50,000 a year, which it is not, it'll use $500,000. That would leave $736,000 for different, occupations within the healthcare arena. So there's funds available for next year, should the policy committees agree. But we don't have a policy committee agreement right now. My recommendation is revert the funds now and then next year, look at it and figure out what to do, and the funds will be there.
Senator Kitchell, we talked informally in our room about, okay, so who else should we add to this list? And, we thought about professions in high demand, and, we thought about the whole list of healthcare providers, including folks in the mental health care providing fields. And we just didn't know how to sort which one of those or which 2 or 3 of those were the right ones in, within these few days. And that's the reason we were thinking maybe this was a conversation for next year.
But if you don't.
Look, I have a hard time just totally reverting the money and that's the end of it. When we're sitting here with all this workforce discussion and workforce need, I mean, we can, if you want to have further discussion, and people aren't comfortable sorting out which occupations, although certainly S11 certainly identified a lot of them, we can revert it and reserve it. I don't just want to dump it back, as a general reversion, because I really think that there's a well-documented need to address this area of workforce assistance. So that's my concern about a general reversion in light of all the information we have relative to the overall healthcare related workforce needs.
Senator, I think that's a great compromise. Revert it and reserve it.
Thank you, Stephanie.
So we'll reserve 700, just to keep the round numbers here.
Okay, all right. And
Okay, so we've just been told that we have a roll call. I'm sorry, so I think we need to take a few minutes to run over. As you know, we are not in the building, so we need a few minutes to run over to the State House. I would really like to keep walking through here. I know also I don't want to keep you all waiting, but we can run.
all right, well, we should
Madam-
probably go offline because it'll probably be at least 10 minutes by the time you get over there and back. And
Madam
At
Chair,
least.
they have not even started ringing yet, so.
Okay,
Okay.
then let's try to walk through. We can't tell from where we are.
You should be able to have a light in there and possibly the alarm will, the bells will hit.
Okay, so just, we will wait until we are urgently called.
Okay, so maybe if we could do just a couple of other ones that probably are going to detail. One of which, I don't know whether we closed out the restorative justice proposed language that you gave us yesterday. I think we were finding it acceptable. We just wanted to get rid of, you have a study and then a report. We wanted to delete in the heading report and change the November date to December 15th. And I just, did you agree with those changes? And then we would insert this language?
Yes.
Okay, so we have that, all right, so that's taken care of. And that'll close out a section because that was one of our differences as well. Now, I had mentioned, I wanted to propose some language. And this has to do with the CSAs, and that's 1,100 again, A8. So general fund appropriation. And I had mentioned the proposal that we had sent to us about allowing a primary healthcare provider to actually to make some of these CSA subscriptions available to a community health center so that they could give them to a patient who had a need of nutritious food because of their health needs. So what this language does is simply add a section is that the agency shall allow a primary healthcare provider to apply on behalf of up to 20 patients for CSA shares that have been recommended for improved health. It was a way of linking this benefit with a group of individuals. And for example, in the Burlington area, their health clinic, they're using contributions and other funds to give these prescriptions out. And the thought was that the CSA share this program would be a helpful resource to address the need of patients because of the healthcare. So it's a way of tying healthcare, better nutrition, local foods, and the funding of the CSA shares. So do you have a copy of that language?
Yes, we do. We've read it and are very intrigued by the notion of food as healthcare, and we accept this language. Thank you for that. Perhaps while we're talking about food and its importance in our communities, you, Senator, you had asked about the food security plan that we had proposed, and I wanted to bring you back in answers to your question about what would be why we were proposing this. So you were recalling that there was a previous report that was done. It was different. It was an agriculture and food system strategic plan that looked at producing and selling more local food. And what this food security plan is focused on is how we would distribute the food in the state to feed people in all circumstances. And it feels like that's tied to the notion of food as healthcare. What we've experienced during the pandemic, obviously, is of people being troubled in their access for food and having to go to extraordinary lengths. And we have spent extraordinary amounts of money locally and at the state level trying to accomplish that. And what we're looking at is a strategic plan that considers all of the issues rather than the kind of one-off efforts that we have been doing during the pandemic. I'm thinking actually prior to the pandemic, when I was working with a local gleaning operation, and we were desperate to find warehouse for the food that we were gleaning, and we were actually talking about storing it in the cold storage facility at our local cemetery, because we just didn't, there wasn't money to figure out how to do proper warehousing and storage. And so we were coming up with really inventive efforts. And so this is an effort to really think about that whole system and make sure that the pieces are appropriately knit together rather than it being, as I said, kind of one-off efforts and responses to emergencies. So let's have a plan going forward for how we're going to behave. And that was the goal of this work.
So it would go to the Agency of Ag.
Yes.
You know, the reason well, we can, this was a one-time money, and we were on our one-time list.
Yes.
Was exactly, I heard that the Vermont Food Bank is engaged, and of course, they have a relationship with Salvation Farms and other cleaning entities. So my question, as well as other food, you know, that it becomes available, and so they have relationships with local, with the chains, the chain food stores, and I've heard that they're engaging in some kind of statewide larger plan. And I'm just wondering to what extent their efforts, which is the largest in a statewide charitable food distribution system that is in present with not only all our food shelves, but in our area, the local hospitals to bring local produce and food. So my question becomes, I guess, have you heard anything specific about what the food bank has in mind relative to
Yes.
plans?
So in fact, yes, they are very much part of this. In an email that I am looking at, I am informed that the Department of Health, Emergency Management, the Food Bank, Hunger Free Vermont, Bi-State Primary Care, and many other organizations will be involved in this process. So it is taking that comprehensive look.
And the source of your email or this information, Representative Cooper, is from where? Because I haven't seen any of it.
It's the Vermont Sustainable Jobs Fund. And we will share this with you. Can we? We will share this with you.
And so would this be a contract, or is this an organization saying they'll do it if they get the money, or?
As you know, we have a rule over on our side that we will not name a contractee. So we are proposing that this be allocated to the Department of Agriculture, the Agency of Agriculture, and that they will sub-grant it. They have a working relationship with the entity that I just described. And I wouldn't be surprised if they weren't an applicant for this, but there is a thought about how this can all flow.
Well, it seems like we're getting back into making decisions around money here, not language, or are we?
That is true. I just, when you raised the question about, noted that food as healthcare, I wanted to take advantage of the opportunity to answer the questions that you had asked about the food security program that we had proposed. So I can move away from that. We can maybe move back to some language pieces because we're still not being dinged.
I would like to go on to the swap language. We found out that what we were attempting to do wasn't going to work. I don't mean to say we won't come back to the 100,000 for planning. Thank you for the information. Everything is hitched to everything, so I can understand why it triggered the plot. And so we have it on our list one time, 100,000. So
Well, before we go to the swap language, do you want to talk about sort of the two other one-time items that have floated into our arena?
Oh, yeah. Okay. Well,
There's 150
this is going to go onto the money list, but we have two things. One of which is funding for a bill that was 150,000 that just hasn't been accommodated, and we would have to, and that Representative Cooper is quite familiar with that bill. And then we have a request that has come to us, and it would be for about 300. We would be asked to allocate $375,000, and it's for ag mitigation related costs to expand the runway at the Highgate Airport. And the Highgate Airport is a state-owned airport, and therefore any enhancements or expansions are adding value to a state asset. And the reason that that the airport runway is need of expansion is that there are a number of entities, 5 businesses, I think up to 5, that are very interested in really using that as a complex for their work, including, we've heard like FedEx, for example. I don't know if not FedEx, but a company that would be using air freight, for example.
It is FedEx.
And some other, well, I think that was FedEx. I don't think we want to be that specific, Senator Westman.
No, but it is FedEx.
Jeez. I guess if you were here, I'd be kicking you under the table.
No,
But
that's
you will not be silenced.
We understand that there is an economic development proposal for the expansion of
Yeah, so,
airport.
we have-
We look forward to whatever language you may have on that.
and so then we have 2 additional funding requests that would be one time. One is on,
Both are one
both
time.
are one time, so one is 150 and one is 375. And so we're sort of like we're adding our list here, but those are 2 that have come in the last, since the morning. So with that, why don't we go back to replace the swap language?
Okay, so it's document number 362826. And do House members have a copy of it there? I think I forgot.
Yeah, I'm about to hand it out. It's happening.
Stephanie, can you read the doc? I got distracted with somebody else. Doc number again, please.
The doc number is 362826.
Okay.
It's the one, it's
Yep,
gonna say
got
up in the header, draft number 2. And if Senators Westman and Ruth have it, and everyone in the room has it. Yesterday, we actually did a version of this, but it turns out that the swap we set up in the budget adjustment is not the same type of swap we did last year, because last year we were swapping before entities had started spending into ARPA money. Turns out we really can't do the swap we even set up in the budget adjustment because labor and AHS are actually spending into the ARPA appropriations that we gave them. And so the idea of not making those swaps and making them contingent in the general fund does not work as it was presented yesterday. What you have here is there is one item that you did in the budget adjustment in ARPA that has not been spent into yet that can be put on the general fund contingent list, and that is the $6 million for the child care retention. And that is an item that Sarah Clark has found out is as it's drafted, as the way the legislature would like that to go forward, it doesn't fit into the guidehouse, so it's actually better to put it into general fund. And so the amendment that you see here would be taking that $6 million off the ARPA list, and you will see it in a second document coming onto the general fund list. And so that's the replacement, the try number 2 of this section C103.
You can swap only 6 million.
Yeah, we're not even gonna swap it. It'll just be, they haven't spent into it, it'll become a general fund contingent appropriation.
Okay. Okay, so that makes sense to us. So thank you. So yes, let's do I assume this is a Senate proposal and we accept it.
Mm-hmm. All right. We both knew that what we had.
Yeah, did
Because of the timing issue.
Yes, thank you.
Okay,
That's good staff work on this one.
that's right. So,
Do you want to go to sort of the mirror image of that one?
yes,
Okay, so the next document is 362835.
Passed them out in the room.
Okay. Wait a minute, I think, this is a 3-page document. I think I just mixed up my
Pages.
yes, yeah, the stapler didn't work on the copier, so now I'm all mixed up.
Yes.
Childcare,
it's on this one.
Okay, thank you. So it's actually, I'm looking for the one that says draft number 1, April 4th on it. It was the last one I sent out to Christina, you and Teresa.
Okay. So then they might need a different one.
So the version that people are looking at, say draft number 1, April 4th, in the top left-hand corner.
The one that I have does not say that.
No,
No,
there's not a timestamp.
no.
We have draft 362835 version 1.
Yeah, I just, the version has gotten a little bit worked on today is,
Let me go into the DM.
This is C102, right?
Yeah.
Yeah, it is.
Yeah,
it should-
mine doesn't have a stamp.
Yes.
In the header, it should say draft number 1, April 4th.
I don't have that either.
I don't have it. It doesn't say anything.
Hang on, I'll pull it up.
We'll get a different one.
And so it's this one that you want. Yeah, but you didn't have a 3rd page, sorry.
Find it, bear with me.
Okay.
It doesn't have a stamp in the DM.
It doesn't.
No.
No.
I'm having trouble with it saving in DM.
I
and it
wonder
kicked me
if-
out. Okay,
So you don't have it?
Do you think it's the same?
I think it is the same. I think it is the same. It should be the same.
Okay,
It was right before I came over that I was having a little,
yeah, that's the version I printed out.
Okay.
Yeah, that should be the,
Okay, I sent what I had then. I think it's the same.
Okay. So what you see in purple in this document, this is the FY 22 contingent list. This is the year-end construct. And so we go back in and we.
Oh,
amend-
you're getting dinged.
You're getting dinged.
Yeah, gotta go.
Okay, but they're just starting. So we've got, can we,
Yeah, you have to go down the stairs across the park.
I'm being told I have to leave.
Either that or we wait and go through the whole thing and vote the
I
second.
think, I think so, because you're not gonna, we probably can't finish going through them.
Okay.
Yeah.
You have to leave.
This will give you time to find the correct one as well.
it's correct. I don't know.
Okay, so what do you want to call it, 15 minutes?
Sure.
Yeah.
So we'll go off live and then once you're back,